Hi, my name is Rebecca Takele, and I'm presenting the use of USMLE Step 1 and USMLE Step 2 required minimum scores in screening urology residency applicants for interview offers. USMLE Step 1 was created to demonstrate medical students' proficiency in the basic sciences learned within the first 2 years of medical school. It has also traditionally been used to screen urology residency applicants. In January 2022, USMLE Step 1 transitioned to a pass-fail system. We sought to evaluate the presence of USMLE Step 1 and Step 2 score cutoffs for candidacy during the 2020 to 2021 urology residency application cycle. Program directors and associate program directors at the 144 accredited U.S. urology residency programs were given a survey at the annual Society of Academic Urologists meeting in 2021. Amongst the question asked was, in the 2020 to 2021 urology residency applicant cycle, what was the preferred minimum score for USMLE Step 1 and Step 2? Answer choices range from prefer not to answer to no cutoff score. Of those who answered, most were in the Western and the South Central AUA sections. 29% of those who responded said that there was no cutoff score for USMLE Step 1. 41% said that there was no cutoff score for USMLE Step 2 CK. Of those that said that there was a cutoff score, the peak range for Step 1 was between 231 and 240. For USMLE Step 2, the peak range was between 236 and 240. In conclusion, 42% of urology residency programs had a USMLE Step 1 cutoff score. 29% of urology residency programs had a USMLE Step 2 cutoff score. On average, the cutoff score for USMLE Step 2 was higher than that for USMLE Step 1. Standardized testing is a somewhat contentious topic in regards to using it as a cutoff to ensure entry into the field of urology. With Step 1 going pass fail, the question becomes, is Step 2 going to be used in the same fashion as Step 1? Used to be. Medical students typically do not find urology until towards the end of their third year. As a result, there's a number of things that they must do in order to successfully match into the field. Because urology is also an early match, some applicants will not have taken Step 2 before interviews are issued. As a result, if Step 2 were to be used in the same fashion as Step 1 used to be used, applicants would have to take it early in their fourth year, incurring more debt in the beginning of fourth year, while also making sure to have dedicated study time in the beginning part of fourth year, possibly taking away from sub-I experiences. These are all factors that must be considered prior to using Step 2 in the same fashion as Step 1 used to be used. Thank you for your time.